Hi, my name is Julia Ball, and my group's topic is transgender visibility. So for my deep dive vlog, I decided to do it on gender-affirming healthcare bans, and more specifically on bans on puberty blockers. So puberty blockers are medication used by trans youths before or during puberty to stop the effects of the puberty of their biological sex, which is not the gender that they identify as. So my thesis says that the government shouldn't ban gender-affirming healthcare that has been proven to help trans individuals just because those individuals are minors, and especially not when the medications such as puberty blockers have reversible side effects, which we will see in just a moment. So my first source is from ABC News, and they have a map that shows you the different laws in different U.S. states. So according to their maps, 12 states, including Georgia, have banned or restricted gender-affirming healthcare in recent years. Georgia's law allows for the use of puberty blockers. However, most other laws do not allow for any kind of gender-affirming medications or treatments. So my quote from this article is, quote, "Puberty blockers taken during puberty use hormones to pause pubertal development. Puberty blockers are reversible," the HHS says. So the HHS is the Department of Health and Human Services, a government organization. And they also say in this article that hormone therapy injections are also partially reversible. So the article also says that that medical associations agree that gender-affirming healthcare does more good than harm, and that's safe and effective. So if medical associations and government organizations are saying this, why is the government changing it? We don't really know. So I believe that the decision should be left to the patient, especially in the case of puberty blockers that are reversible if the individual comes to change their mind, which very rarely happens. So I wanted to see what laws were like in other countries, so I chose Sweden because Sweden is known for being very liberal in their policies regarding LGBTQ plus people. So I learned that Sweden has reversed their policy of allowing gender-affirming healthcare to be administered in favor of a, quote, "new caution to avoid hormones except for exceptional cases. A more cautious approach that prioritizes non-invasive interventions is now recommended." Those non-invasive interventions are therapy and other stuff like that. So now the administration of gender-affirming medication is only allowed in research settings and with a prerequisite of 5 years minimum of gender dysphoria. And it's also prioritized for biological male patients. So, under new guidelines, at the current time, youth who identify as non-binary will not be eligible for hormonal interventions, even in research settings. We can see why this is problematic because non-binary individuals also fall under the transgender umbrella. So I couldn't find a basis for this reversal, and in my opinion, the medical association shouldn't have reversed their enduring decisions without proper explanation of why to the people that this affects, and also without any research that says that these medications are not good for our youths. So my third article is from NBC News, and it's about Florida's transgender ban. So we all know what kind of anti-LGBTQ plus laws are being passed in Florida. So Florida's Board of Medicine has passed a rule that bans all kinds of gender-affirming healthcare to minors in the state. This includes puberty blockers. The medical board member says there wasn't enough evidence to justify allowing minors this healthcare, but as we heard earlier, the HHS, a government organization, has said that the benefits outweigh the bad and that most medication is reversible. So those two areas just don't line up. The NBC article states, quote, "At a final public hearing February 10th, multiple people said the rule contradicted most medical evidence as well as guidance from nearly all relevant medical associations in the U.S., including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association." This ban is already being protested in the streets and in courts by unhappy parents. So one of the reasons for that Florida is using to allow this is that they say that transgender people usually regret the use of this medication. So another quote from this article is, quote, Jim Lepresi, the founder of SunServe, a medical health service agency in Fort Lauderdale that treats LGBTQ youths, said about the claims that trans people feel regret in their transition later on in life. When we hear about regrets, it's usually from persons in the trans community who regret that they didn't do it sooner. That is far more frequent and experienced. So, when most medical professionals, medical associations, and research supports the use of gender-affirming healthcare, the government shouldn't stand in the way of that, and the government shouldn't be allowed to tell parents what medical treatments and medicines their children should be able to participate in. These kind of laws are detrimental to the health, safety, and happiness of transgender youths, and we must protest against these bills. And I also had 2 other resources to learn and keep an eye out about this issue. The first is from translegislation.com. It has all proposed, past, and debated laws, and it has maps and short and simple explanations of what the laws will do or what the past laws do. The other one is kff.org, which has lots of useful information to learn about what specific states are doing, breaks down federal and state policies regarding gender-affirming healthcare, and what medical associations say about gender-affirming healthcare, and implications for all kinds of different people that will be affected. Thank you.